Hi and welcome to today's discussion about pneumonia. What is pneumonia? Lung infection when it is involving the parenchyma is called as pneumonia. And yes, it kills. Either by exacerbating COPD or asthma it kills, or it is a big killer among the children. What you and me need to know about pneumonia is we've already learnt during the COVID pandemic. But there is something more which you and me need to talk about it, learn and share. I would leave this acronym pneumonia in front of you on World Pneumonia Day. November 12th, we will be celebrating Pneumonia Day. I want you to share this video. P is for pneumococcal vaccination. Pneumococcal vaccination is needed for everyone who has got diabetes, who's got HIV, who's a smoker or an alcoholic, or if you have had a splenectomy done. Have you got CSF analysis or CSF leak present for any neurological disease? Then take pneumococcal vaccine, says Harrison, the Bible of all the internists. N is no for smoking. Yes, smoking directly connected with the lung infections. E is exercise regularly. Breathing exercises. You want to live for 100 years? Hold breath for 100 seconds. Take a deep breath. Now hold this for 100 seconds to assure that you have a healthy lung. There are unusual situations like uremia or kidney failure when you can have a pneumonia. There are unusual diseases like cystic fibrosis which you need to know about it. Go to your usual job of going to doctor before it is too late. So make sure you have usual visits to your doctor before it is too late, because majority of patients come to us when it is too late and we feel uncomfortable. So this pneumonia day, take a usual walk to your family physician. M is malignancy, that means cancer. Can cancer present in the form of pneumonia? The answer is yes. So if your doctor is ordering any invasive or the costly test, it's right for you to ask, but understand the doctor is ordering a test like CT scan or invasive procedure like bronchoscopy because he has somewhere in his mind there is possibility of malignancy or cancer. O is obesity. Obese people do get pneumonia more and more often. So yes, obesity needs to be worked upon. You want to have a healthy lung, then reduce weight if you are more than needed. N is there are newer interventions which are there, but all those newer interventions are not necessary. Only thing is you must never delay in reaching out to a doctor. During COVID pandemic, we've had patients using their self-medication. We felt sorry, we felt unhappy because yes, we lost a lot of our patients because of their self-knowledge and work by themselves on their own health. 20 minutes of Googling cannot be equated with 20 years of experience of a specialist, and you need to stick to the professional advice. I is immunity, I is influenza vaccination. Everybody on this earth requires flu shots to be taken every year, and that's not we have learned in last 1 or 2 years. We know it more than 2 or 3 decades. In Western world, apparently you don't get your paycheck if you're not taken flu shot. So I is influenza vaccine to be taken annually if you're a diabetic, if you're HIV patients, if you are smoker or alcoholic. And yes, A is for alcohol, A is for age. If you're aged, you will require the flu shot and pneumococcal vaccination, and you require long breath to live long. This pneumonia day on 12th November, let's live happy, live smilingly, and protect our lung by taking long breath for a long life. Take a long one like the way I am taking it and sign out at this time with this long breath. Goodbye.